According to the World Health Organization, mental health is a state of well-being in which every individual realizes his or her own potential, can cope with the normal stresses of life, can work productively and fruitfully, and is able to make a contribution to his or her community. Whereas mental illness can be described as a health problem that significantly affects how a person thinks, behaves, and interacts with other people. It includes but is not limited to conditions such as anxiety, bipolar, schizophrenia, personality disorders, depression, and eating disorders. Based on a recent study reported by Beyond Blue Australia, each year 1 in 5 Australians will experience a mental illness. This report released also identified that in their lifetime, 42% of females will experience a mental illness, and 47% of males will experience a mental illness. Rates of mental illness in Australian youths are known to be on the rise, with 1 in 4 young Australians currently being affected by mental illness every day. 1 in 16 young Australians currently being affected by depression every day, and 1 in 6 young Australians currently being affected by an anxiety-related condition. The effect of mental illness on Australian youth is far-reaching and not limited to the well-publicised social withdrawal many people experience. Adolescents with mental health problems are more likely to be involved in other health risk behaviours, with 23% of Australian youth with a mental illness engaging in regular smoking, 37% reporting that they regularly consume alcohol, and 18% are said to have taken illicit drugs. In 2015, 198 young Australians died as a result of car accidents. In 2015, 324 young Australians died as a result of suicide. In Australia, suicide is the biggest killer of people aged between 15 and 24. So with all that being said, we can conclude that mental illness at some point will likely directly or indirectly affect every Australian's life. So if you or anyone you know needs help, tell them to contact Beyond Blue or Lifeline.